Breast milk is the best and perfect food for your baby. It contains all the nutrition, all the fluid, everything your baby needs. It also includes antibodies that can help prevent your baby from being sick. Plus, the mere act of breastfeeding is one of the best ways that a new mom can bond with her new baby. But what if breastfeeding isn't so simple? What if there's problems with breastfeeding? Today I have with me Caitlin Hainley. Caitlin is a certified nurse midwife and an international board-certified lactation consultant. Caitlin, can you tell us a little bit about some of the common problems that new moms have in breastfeeding their babies and what they can do about it?
Yeah, Dr. Jason, I think that moms can have a lot of common problems in the early days, ranging from just how to position and how to latch their babies is something that happens very early on with moms, to other complications such as low milk supply or infections such as thrush or mastitis. And we'll talk about those a little bit more in depth as we go along today. But one of the best things that moms can do to head off those problems early on is find a lactation consultant or a provider very knowledgeable in lactation and have a visit with them while they're still pregnant to talk about and plan for their breastfeeding journey. A lot of times we assume it's natural, so it will be easy, and then we just wait for it to be natural and easy, when sometimes just because it's natural doesn't mean it's so easy. So meeting with someone ahead of time, having a plan, talking through all of these things before they become an issue can really make a difference. Education is key, as in so many other things. Just to specifically talk about some of the things that I mentioned, the first thing I would really like to hit on is just some basics of early position and latch. And this is, right as soon as baby's born, if baby is stable and doing well, baby should go skin to skin with mom. We have lots of studies that show that skin to skin promotes breastfeeding and helps breastfeeding get off to a smooth start. When we think about latching our baby, I like to talk to people about the cheeseburger method of latching. So I'm just going to grab a little prop down here. So when we talk about latching and how to position our hands on our breast to help baby maximize that wide open latch, we try to visualize how we ourselves would eat a cheeseburger. So imagine you're at a diner and you have a really big cheeseburger. I mean, it's a fat patty, it's got cheese, lettuce, tomato, onion, everything on it. You're really gonna have to squish that cheeseburger to get it in your mouth. Do you squish your cheeseburger like this? Or do you squish your cheeseburger like this? Now, everybody's probably saying, you squish your cheeseburger like this because it makes it easier to get a bite. If you squish that cheeseburger like this, that just made it really long and really hard to get in your mouth. And it's the same when we're breastfeeding babies. So when we think about our baby's mouth coming onto our breast, we want to make sure that we're compressing in the way that the baby would eat a cheeseburger. So if baby's positioned across us in what's called a cradle or a cross cradle hold, we want to be compressing our breasts at the 3 o'clock and the 9 o'clock position, because that narrows the area where the baby latches on. If baby is in a football hold, then their mouth is approaching the breast in a different position. And we want to position our compression at the 6 and the 12 o'clock hold, because that is what makes that cheeseburger a lot easier to get in our mouth. So you kind of think when you are positioning your baby and helping compress that breast a little bit to help baby get on, that you want to match that compression to the way that's going to provide the narrowest amount of breast tissue so that baby can get a good wide latch. Some other techniques when we think about breastfeeding are we really want to keep baby tummy to tummy with us. And that helps because if baby is tummy up and then having to turn their head to nurse, think about us having to turn our heads and drink a glass of water. How hard would that be? It's just not a natural position. So making sure that baby is very lined, ear, shoulder, hip, and belly button to your belly button will make a big difference in getting baby in a comfortable position that helps them do their best latching. One of the biggest questions moms have along their breastfeeding journey is, how can I tell I'm making enough? You know, bottles have those really nice little milliliter and ounce marks on them. Our breasts don't have that at all. So how do we know that our baby's getting enough milk? There's 3 things that we look at to make sure that babies are getting enough milk. The first and most important is weight gain. All babies lose a little bit of weight in the first few days of life, but they really shouldn't lose more than 10% of their body weight, and they should be back up to birth weight by 2 weeks. So it's really important to go to those early checkups with your provider at 3 to 5 days postpartum, at 2 weeks postpartum, and make sure that baby's weight loss is within the range of normal and that baby continues to gain weight when they should. So one of the ways that we know that babies are getting enough is weight gain. Another way that we know that babies are getting enough is wet and dirty diaper counts. The more we intake, the more we output, and babies are no different. So make sure that you're discussing with your provider what's normal for wet and dirty diapers on day 1 of life, day 2 of life, day 3 of life, because it changes rapidly in that first week. So paying attention to our baby's output can help us know and feel confident that they're getting a great intake of milk. The third way that we kind of gauge that baby's getting enough is we listen for those audible swallows at the breast. Now, when babies are really little and they're down here and our ears are up here, it can be really hard to hear those swallows, and they can sometimes sound like little clicks or little breaths, like. And if we're worried about that or weight gain in general, that's a really great time to either see a provider who's very knowledgeable in breastfeeding or to find a trusted lactation consultant, because they can check all of those things and go over all of those with you. They can listen with you to baby's audible swallows. They can go over your baby's wet and dirty diaper count, and they can weigh your baby and give you that peace of mind of knowing that you really do have a great milk supply and you are able to provide enough for your baby.
In the 20 years or so that I've been seeing babies and answering questions from moms, I've learned more in the last 10 minutes of listening to you talk, I think, than over that 20 years. So thank you so much for helping me with this video today. Parents, remember that breastfeeding is one of the best things that you can do as a parent, and one of the best things that you can do for your baby. It's not always easy, but there are things you can do if you're having problems. New moms, you got this. See you soon. Please hit that little thumbs up to like this video, subscribe to our channel, and then hit the little bell so that you won't miss a thing.